If you've been told that your blood pressure should always be as low as possible, today's discussion may surprise you. For many older adults, chasing the wrong number can sometimes create new health risks instead of protecting against them. The truth is more complicated than most people realize, and before you make any changes to your medication or daily routine, there are several critical facts you need to know. One of them could completely change the way you think about healthy blood pressure after the age of 60. I'm Dr. William Lee, and one of the biggest misconceptions I see is the belief that every senior should have exactly the same blood pressure target. That's simply not how the human body works. As we age, our blood vessels naturally become stiffer, our circulation changes, and our brains and kidneys may respond differently than they did decades earlier. The ideal blood pressure isn't just about avoiding high numbers, it's also about making sure your vital organs receive enough blood every minute of the day. Stay with me, because in a moment, I'll explain why a number that looks perfect on paper could actually leave some older adults feeling weak, dizzy, or at greater risk of falling. For years, researchers have studied whether lowering blood pressure aggressively reduces the risk of heart attacks and strokes. Large clinical trials, including the well-known SPRINT study, found that carefully selected adults benefited from more intensive blood pressure control, especially regarding cardiovascular events. But here's the detail that often gets left out. Those patients were closely monitored by healthcare professionals, and not every older adult fit the same profile. That's a distinction that many headlines failed to mention. This matters because blood pressure isn't simply a score to beat. It's the force that delivers oxygen and nutrients to your brain, heart, and every other organ. If that pressure climbs too high for years, it damages delicate blood vessels, increasing the risk of stroke, heart disease, kidney damage, and even certain forms of cognitive decline. But if blood pressure drops too low in someone whose arteries are already stiff, the brain may not receive enough blood during standing or sudden movement, leading to dizziness, confusion, or dangerous falls. In the next minute, I'll reveal one warning sign many seniors ignore until it's too late. Have you ever stood up quickly and suddenly felt lightheaded? Many people dismiss this as normal aging, but it can sometimes be a clue that blood pressure is dropping too much when changing positions. Doctors call this orthostatic hypotension. In older adults, repeated episodes may increase the risk of fractures, hospitalization, and loss of independence. That's why your healthcare provider may measure blood pressure while you're sitting and standing, not just during one quick reading in the office. Another important point is that a single blood pressure reading rarely tells the whole story. Stress, poor sleep, dehydration, pain, caffeine, and even rushing into a clinic can temporarily raise your numbers. Home monitoring, when done correctly, often provides a much clearer picture. Measuring at the same time each day after sitting quietly for several minutes can help your healthcare provider make more accurate treatment decisions instead of reacting to one unusually high or low reading. So what is the best blood pressure for older people? For many healthy adults over 60, current medical guidelines generally aim for a systolic blood pressure below 130 millimeters of mercury when it can be achieved safely and without significant side effects. But that target should always be individualized. Someone with frailty, frequent falls, multiple medical conditions, or symptoms from low blood pressure may require a different approach. The safest goal is the one that lowers long-term cardiovascular risk while allowing you to stay active, alert, and independent. Your brain depends on healthy circulation every second of the day. Chronic high blood pressure can gradually damage tiny blood vessels that support memory and thinking, contributing to vascular cognitive impairment and increasing the risk of dementia over time. That's one reason doctors encourage early treatment before symptoms ever appear. Protecting your blood vessels today may help preserve your memory years from now. Remember, the goal isn't to chase the lowest possible number. The goal is to find the healthiest number for your body through regular monitoring, healthy eating, physical activity, quality sleep, stress management, and medications when they're truly needed. Never stop or adjust blood pressure medicine without speaking with your healthcare provider, because sudden changes can be dangerous. There's another blood pressure danger that rarely gets the attention it deserves, and it often begins without any warning at all. Many older adults feel completely normal while silent damage is happening inside their arteries. That's why high blood pressure is often called the silent killer. You may have no headache, no chest pain, and no obvious symptoms. Yet every heartbeat could be placing extra strain on the tiny blood vessels that nourish your brain, eyes, kidneys, and heart. But here's what most people don't realize. The damage doesn't happen overnight. It builds slowly over years, making early prevention one of the most powerful tools you have. One of the first places this hidden damage appears is inside the lining of your blood vessels. Healthy arteries are flexible, allowing blood to flow smoothly with each heartbeat. Over time, uncontrolled high blood pressure creates tiny injuries in that delicate lining. Your body tries to repair those injuries, but repeated stress can lead to inflammation, plaque buildup, and stiffened arteries. Think of it like repeatedly bending a garden hose until it becomes less flexible. The harder your heart has to pump against those stiff arteries, the greater the strain on your entire cardiovascular system. Now here's where things become especially important for adults over 60. As arteries lose their flexibility with age, the top number of your blood pressure, known as systolic pressure, often rises, while the bottom number may stay the same or even decrease. Many seniors look only at the lower number and assume everything is fine. In reality, an elevated systolic pressure can still significantly increase the risk of stroke and heart disease. That's why your healthcare provider pays close attention to both numbers instead of focusing on just one. There's another hidden factor that surprises many families. Blood pressure doesn't stay the same throughout the day. It naturally changes while you sleep, exercise, eat, or experience emotional stress. For some older adults, blood pressure remains high throughout the night instead of dipping as it normally should. Research suggests that this abnormal nighttime pattern may be linked with a greater risk of heart problems, kidney disease, and cognitive decline. In certain situations, your doctor may recommend 24-hour ambulatory blood pressure monitoring to uncover these hidden patterns that a single office visit could easily miss. Let's talk about memory, because this is where many viewers become concerned. Your brain contains billions of nerve cells that depend on a constant supply of oxygen-rich blood. When high blood pressure damages the tiny vessels deep inside the brain, communication between these cells can gradually become less efficient. Over many years, this vascular damage may contribute to slower thinking, reduced attention, and an increased risk of vascular dementia. While dementia has many possible causes, protecting your blood vessels is one important step that may help preserve cognitive function as you age. The encouraging news is that your blood vessels are remarkably responsive to healthy lifestyle changes. Even modest improvements in blood pressure can reduce stress on your arteries and lower the risk of serious complications. Regular walking, limiting excess sodium, eating more fruits and vegetables, maintaining a healthy weight, avoiding tobacco, and managing diabetes and cholesterol all work together to protect your heart and brain. These habits may seem simple, but when practiced consistently, they create meaningful health benefits over time. Before we continue, there's one everyday habit that could be causing your blood pressure readings to appear much higher than they really are, leading some people to worry unnecessarily or even receive treatment based on inaccurate numbers. In the next part, I'll reveal the surprisingly common mistakes people make while measuring blood pressure at home and how correcting them could completely change the readings you see on your monitor. Now I'd like to hear from you. What blood pressure numbers are you usually seeing at home, and has your doctor ever changed your target because of your age or other health conditions? Share your experience in the comments so others can learn from your journey. If you found this information helpful, subscribe to the channel, turn on notifications, and share this video with a friend or family member who wants to protect their heart, brain, and independence for years to come.